So we actually see quite a few cataracts at our clinic. We have an ophthalmology referral service which comes down here once a month and does a lot of cataract surgery. So a cataract is basically an opacity in the lens in the eye. And if you look at the eye, it gives a really kind of white appearance. Early on it may look almost a little bit of a crystalline sort of appearance. Now, it's quite important that we don't mistake a condition called nuclear sclerosis for cataracts. So nuclear sclerosis is basically a slight change in the density of the lens, and it's quite a normal part of aging, and that's why it's very similar to the process that occurs in people where we require reading glasses as we get a little bit older. The lens doesn't flex and change as much as it should do, and that just creates a slight bending of the light, and that can appear as a white hazy appearance. So that's nuclear sclerosis. That's very different to cataracts and doesn't actually require any treatment. So cataracts, we tend to have a couple of main causes of them. We have primary cataracts, which are quite often a genetic component. So certain breeds of dogs can develop cataracts for no apparent reason, or we can have secondary cataracts, and they tend to be most commonly due to diabetes. Most diabetic dogs will develop cataracts with time. Conditions such as uveitis or penetrating injuries into the eyes, or anything that creates quite a severe inflammation in the eyes, can also cause cataracts. So if you're concerned about your dog having cataracts, it certainly needs to be assessed by a vet to differentiate between a cataract and nuclear sclerosis, because like I say, nuclear sclerosis doesn't really need anything. Your dog would need reading glasses if it read the paper, but that's obviously not such an issue. Cataracts really are a surgical problem. There's no medication which will clear up a cataract. So the most common procedure is a procedure called phacoemulsification, and basically what happens is a small incision is made into the eye. The cataract the lens is broken up using sound waves, and then the lens is removed in small pieces, the eyes closed. Quite often an artificial lens is inserted to help with the pet's vision, because obviously the vision would be pretty poor without any sort of lens. And then we basically manage these dogs with medication for potentially a month or two afterwards, just to ensure the eye heals up well. And then we expect the dog to return to normal vision or normal activity and have quite good vision, not quite as good as it would before cataracts, but still good enough for normal, good quality of life. So cataracts, certainly there's something that can be done. We need to differentiate between cataracts and nuclear sclerosis, and if you're concerned, contact your vet.